How are you, good people?
Thank you. Fine, thank you.
Uko salama?
Salama kabisa.
Okay, are you guys ready? I am here with a team from MOH, PS Oluga. We have the CEO of the Social Health Authority. We have the chairman of the Social Health Authority. We have the CEO of the Digital Health Agency. And I have Dr. Mwai and Dr. Thuranira from the President's Advisory Team on Health. So we have a press statement to issue. This time not on UHC, on SHA, and we are very, very categorical. We are focused. We know what we are doing. We will not succumb to what is in social media. We will give the people of Kenya the true facts as they are, and we shall continue the way we have given a few minutes ago on UHC. I have called this press conference today to provide a very comprehensive update on our relentless effort and fight against fraud, and to address recent discussions, including those on social media and from various professional associations. Our position on safeguarding public resources has been very consistent, clear, and unwavering. As articulated in my previous press statement, which I did on the 16th of June, on the 30th of June, and on the 8th of August, our commitment to uncompromising stance against fraud is a foundational pillar of the Taifa Care program. These concerns now being raised are not new to us. They have been an integral part of our public discourse and enforcement actions from the very beginning. This position is rooted in our constitutional obligation under Article 43(1)(a) of the Constitution of Kenya, which guarantees every Kenyan citizen the right to the highest attainable standard of health. To fulfill this right, we must ensure the prudent and accountable use of public funds as mandated by the Public Finance Management Act. Every shilling, I repeat, every shilling contributed to the Social Health Insurance Fund must go towards legitimate, life-saving healthcare for the people of Kenya. On ensuring transparency and social accountability, we are committed to transparency, and that's why we have continuously published the list of health facilities paid by the Social Health Authority, even though we are not legally required to. This public-face approach ensures the public can hold us and healthcare providers accountable. In that spirit, here is the current status of claims processing since Taifa Care rollout on the 1st of October 2024. The claim status for PHC, or the Primary Health Care Fund, which is free, which Kenyans access at level 2, level 3, and level 4 outpatient, and paid for by the government under the leadership of President William Ruto. The total claims submitted since October 2024, health facilities have submitted claims totaling 9 billion shilling to SHA. The total claims paid, SHA has paid out of that 9 billion, 7.7 billion to health facilities. We have the health facilities, their names, their bank accounts, and we can account for every shilling we have given to them. The balance, which is 1.3 billion, will be paid in the next payment cycle. Claim status for the Social Health Insurance Fund. The total claims submitted, health facilities have submitted claims to SHA totaling 82.7 billion. Total claims which have been paid, which SHA has already paid, is 53 billion for the claims submitted by health facilities and which have been verified and which have been counter-checked. The system has proved that these claims are genuine. These claims have been performed. We can trace to the patient. We can trace to the doctors who did those surgeries. We can trace to the drugs dispensed to the people of Kenya. Total claims approved and waiting payment. Claims totaling 6.4 billion have been approved so far and are pending payment. These claims are for part of the portion of July and will be paid in the next cycle. In fact, even within this week, some of those claims will be paid. They are just going through verification. Total claims rejected. And we shall give you the reasons why they have been rejected. Because the biggest issue we are facing, which has bedeviled the former NHIF, is fraud. Claims worth 10.6 billion have been rejected due to fraudulent activities and non-compliance. This action is taken under the authority of Section 48(5) of the Social Health Insurance Act 2023, which outlines penalties for providers who knowingly or fraudulently alter information to defraud the authority. Later in my press statement, I'll give you the various methods in which this fraud was being perpetuated by these health facilities in whose claim totaling 10.6 billion have been rejected. And we'll give you an example of some of those facilities. Claims for re-evaluation. Claims worth 3 billion are being re-evaluated due to missing documents. Claims worth 2.1 billion are under surveillance for further investigation. The system is looking at 2.1 billion claims, which, in our opinion, and the systems and the forensic auditors are re-evaluating and are doing surveillance. This vigorous process is a key part of the authority's function under Section 35, subsection 2 of the Social Health Insurance Act 2023, which mandates the Claims Office to review, to process, to validate medical claims, and to conduct quality assurance surveillance. So everything we're doing in terms of review, in terms of process, in terms of validating medical claims and records, and in terms of conducting quality surveillance assurance are all anchored in law. So we are not doing anything outside the law. Claims totaling 7.6 billion for the month of August are currently under review. They are not due. Once the cycle is due on the 14th of September, those claims will be looked at, and if they comply and they are genuine claims, they will be paid. A deeper look at the fraudulent activities. The healthcare fraud is a global problem, draining an estimated 3 to 15% of the healthcare expenditure annually. In Kenya, the Association of the Kenya Insurance, AKI, reports that fraudulent claims account for 30% of all payouts. This isn't just a challenge for us at the Social Health Authority and the Ministry of Health. It's a systemic menace. Our rigorous enforcement is a necessity, and let me say it's not an option.